Hi, I'm Dr. Liz Chamberlain. I'm a psychologist, and I primarily work at the CU Weight Management and Wellness Clinic in the Anschutz Health and Wellness Center. People see me for lots of reasons. When people are feeling stressed, that's often usually what they present with. But I see people who have anxiety, depression, difficulties with food. A lot of times, food is related to more than just eating for hunger. So I see people to help them manage their weight, but more importantly, really to notice what they use food for. I've also done a lot of work with couples, and I'm Gottman therapy trained. So I work with couples, families, sometimes mostly adult couples. But people come to see me for relationship issues, if they're struggling at work, just if things aren't quite working and they've done everything they can to figure out how to make it work, but are still just not quite getting where they want to go. I have a pretty eclectic approach, but most of the way that I treat my clients is really based in more narrative therapy and more person-centered therapy, meaning when someone comes to see me, I really try to rely on their expertise. I ask them a lot of questions to see if we can collaborate and find what their expertise and my expertise combined can help create and can help maybe find some of those blind spots, see what might be happening out in the periphery that we can't always see. Typically I really just like to get to know somebody, but I do like to ask a lot of questions that they may not know to ask themselves, to really figure out and unpack what some of the issues might be underlying some of the obstacles that they're finding in their lives. There are lots of evidence-based therapies that exist. I tend to gravitate more toward the mindfulness-based interventions. So mindfulness-based stress reduction is one, mindfulness-based cognitive therapy is another, and the third one is mindful self-compassion, and those are three evidence-based therapies. They also have programs, 8-week programs that I work with. The mindfulness-based cognitive therapy was developed initially for treatment of depression specifically. It works with depression, works with anxiety, works with lots of other issues. So it really just takes the mindfulness-based interventions, which really just include noticing and observing your own body sensations, your emotions, and your thoughts, more like a scientist. Instead of getting caught up in them or having stories about them. And then also using more cognitive behavioral strategies, which is examining the thoughts that go along with the feelings when something happens. So that's kind of the nutshell of what more mindfulness-based cognitive therapy is. And there are steps within it. And sometimes we take those steps, sometimes we work with those just as we go along. It really depends on, what's most helpful for any individual. So I would say that psychologists can be helpful for lots of different reasons. But if there are things in your life that you feel like you've done everything you can to figure out how to make them better, that's a good reason to go talk with somebody just to get another perspective, or maybe to see some of those ideas that may not be as apparent to you. Since we all get tunnel vision, right? I do too in my own life, and I can't see sometimes other ways to manage a situation or handle a problem. So a psychologist can really help you figure out some different ways and give you some different tools to really help you feel you're more effective in your relationships, in your work life and your home life, or if you have some goals that you'd like to meet, a psychologist can help you devise a plan to meet those too. And I always encourage people, if they're on the fence and think maybe I should go, just to try an initial session and see if it's a good fit. That's the other piece, to make sure you fit with somebody that you see, and just see if it's helpful, even just to talk through some things in a different way. So if you're on the fence, I'd encourage you just to try it and see how it goes. You don't ever have to schedule another appointment if it's not for you, but if it's something that might be helpful, then you can continue to pursue that.